The second nursing theories we're going to discuss is Mary H. MISHEL and her theory of uncertainty of illness. MISHEL was born in 1939 in Boston, Massachusetts. She graduated from Boston University in 1961 and received her MS in psychiatric nursing from the University of California in 1966. MISHEL completed her MA and PhD in social psychology at the Claremont Graduate School. Next to discuss is MISHEL's fourth meta-paradigm. Person is described as having experiences uncertainty gradually as the illness insidiously invades life, wherein the uncertainty in illness theory helps to address this effect on patient and assists with coping mechanism. Using MUIS, or the MISHEL Uncertainty in Illness Scale tool, clinicians can identify areas of illness that are causing the greatest uncertainty in the environment. In terms of health, illness affects many aspects of life, and with increased research that is shown how the theory can be used to help a variety of patients in different environments. The uncertainty in illness theory provides ideals to view the experience of acute and chronic illnesses and to organize nursing intervention to promote optimal adjustment. It explains the stresses associated with diagnosis and treatment of major illness or chronic disease. MISHEL created a scale for the testing of perceived ambiguity in illness. This was later renamed the MISHEL Uncertainty in Illness Scale, or MIUS. Next up is critique for this theory. Uncertainty is primary concept of this theory. It is defined as cognitive state in which individuals are unable to determine the meaning of illness-associated events and construct meaning from them. The antecedent of the uncertainty includes stimuli frame, cognitive capacities, and structure provider. The second conceptual component is the appraisal. There are two processes which involve appraisal. First is the inference, which is constructed from the individual's personality, disposition, and includes learned resourcefulness, mastery, and focus of control. Second is the illusion, that is the belief constructed from uncertainty that considers the favorable aspect of a situation. Uncertainty is viewed as an opportunity primarily through illusion, but inference who can lead the individual appraising the situation as having positive outcome. Coping is a third component that occurs in two forms. If uncertainty is appraised as danger, then coping includes direct action, seeking information from mobilizing strategies, and if it is appraised as an opportunity, coping offers a buffer to maintain uncertainty. Simplicity pertains to the antecedents of uncertainty, which are concise and their definition are clear and simple, the outcome of which can be divided into two, relating to patients with acute illness and representing an expansion of the model to accommodate patients with chronic illness. The generality for the theory may be applied by different health professionals and may be applied in many areas of nursing due to its broad consent. Last, for the critic is the importance. The theory serves as a guide in discovering something new in the field of nursing. Its framework may serve as a basis of providing various ideas that may develop new practices and beliefs that may contribute to a patient's well-being. The major concepts and definition MISHEL discussed are the following. Uncertainty, it is the inability to determine the meaning of illness-related events occurring when the decision maker is unable to assign definite value to objects or events or is unable to predict outcomes accurately. Cognitive schema is person's subjective interpretation of illness, treatment, and hospitalization. Stimuli frame is the form of composition and structure of the stimuli that a person perceives, which are then structured into a cognitive schema. Next is the event familiarity, which is the degree to which a situation is habitual or repetitive or contains recognized cues. Structure providers are also known as the resources available to assist the person in the interpretation of the stimuli frame. The degree of trust and confidence a person has in his or her health care providers is called credible authority. Another definition is social supports, which is the influence uncertainty by assisting the individual to interpret the meaning of events. Capacities is information processing abilities of a person, reflecting both innate capabilities and situational constraints. Adaptation, which is the one that reflects the biopsychosocial behavior occurring within persons' individually defined range of usual behavior. Lastly, probabilistic thinking, which refers to a belief in the conditional world in which the expectation of continual certainty and predictability. Now, let's go to the major assumption. For two, assumption reflects how uncertainty was conceptualized within psychology's information processing, with this being uncertainty as a cognitive state and inherently neutral experience. Last two assumptions depicts adaptation relationship to the theory. Adaptation represents the continuity of an individual's usual biopsychosocial behavior and is a desired outcome of coping efforts to either reduce uncertainty, appraise as danger, or maintain uncertainty, appraise as opportunity. The relationships among illness events, uncertainty, appraisal, coping, and adaptation are linear and unidirectional, moving from situation promoting uncertainty towards adaptation.